Welcome to Prescribed by Dr. Nathan Goodyear, where Integrative Oncology meets holistic healing. This podcast is your home for the latest in innovation, exploration, and elevation in all areas of integrative oncology, medicine, health, wellness, and beyond. Join me and a host of other innovators as we go from practicing to prescribing. Your daily dose of wellness begins now. What if timing, not just the treatment, not just what is chosen, surgery, chemo, radiation, immunotherapy, or targeting, but what if timing is the key to cancer destruction? Welcome to another hot take here on Prescribed by Dr. Nathan Goodyear. Hot takes, again, are kind of our intermediate form, not the short reels, not the long format in the podcast, but it's kind of that intermediate there. So this is a hot take and talking about a study that was published in 2019 in Radiation Oncology. Yes, it has implications here to the integrative world. The title of the article was Time Synchronized Immune-Guided Radiation, Partial Bulky Tumor Radiation Targeting Hypoxic Segments while Sparing Peritumoral Immune Microenvironment. So when you look at targeting a tumor, one of the big fallacies and the problems related to cancer treatment from a systemic to tumor approach is that you're destroying the immune system. You damage it irreparably. And the research has showed this, looking at the different T lymphocytes, CD4, CD8 cells. It's shown this. And this is a key mechanisms of how it can actually spread cancer, cause local recurrence. This is not open for debate. But we have to also recognize that we must preserve the immune system if we want treatment to be successful long term. See, surgery, chemo, radiation, they do a great job of providing short-term resolution, short-term remission. But what is short-term remission if it just comes back stronger and more aggressive and everywhere? It's cutting off your nose to spite your face. It's actually cutting off your head to spite your body, but it's cutting off your immune system to provide a short-term gain. We need to change our perspective. So going to war on cancer has brought us this approach. We need to move towards this precision cancer care, which is working to preserve the immune system, preserve and activate the immune system to harness its power, its mechanisms of defense, but target the tumor at the same time. So that must be a dual objective here. And this study was looking at radiation and trying to find the right time to actually preserve the immune system, actually harness the power of it, if you will. So first, we have to touch on a concept here called about circadian rhythm or circadian clock. And when you hear about circadian rhythm, most people would think of it as it relates to hormones, cortisol, melatonin, metabolism, right? So this is what people think of it when it relates to circadian rhythm. But research is not actually now showing this applies to the immune system as well. And so it's not just physiologic process. So here's just a few interesting quotes. Biological timekeeping mechanism that governs endocrine, metabolic, and immune function to maintain physiologic homeostasis. So when the immune system becomes non-homeostatic, that's balanced, guess what? Things like cancer take advantage of it. The clock affects innate immunity by regulating time of day dependent, get that, time of day dependent production and trafficking of cytokines and chemokines. These are immune signals, as well as immune cell maturation and tissue infiltration. See, did you get what they're saying here? The movement and trafficking of immune signals and immune cell maturation, infiltration, and activation, it's time dependent. It's on a circadian clock. And this circadian clock has been linked with cancer types: breast, ovarian, prostate, melanoma, head, neck, liver, lung, colorectal, pancreatic, glioblastoma, and CRAS-positive tumors. And then there's this concept of what's called chronomedicine. It's the timing of the delivery of cancer therapeutics, which can significantly impact treatment outcome. So we can no longer just say, well, we're going to do this treatment, take your choice. It has to be now governed based on the circadian rhythm. And there also is this concept of what's called chronicity mapping, where you're actually mapping each person's individual circadian rhythm so as to match treatment. So do you see where precision's going? It's matching not just genomic mutations, transcriptomics, proteomics, metabolomics, metabolomics, microbiomics. It's targeting circadian rhythm. So this study is really getting into that concept there. And so they introduced what they called partial tumor irradiation targeting hypoxic clonogenic cells. So when you think about a tumor, you have to think a lot of what's in those tumor are clone cells. They're cells that are not the original cell type that's normal and healthy, but these are clones that are abnormal. Now, obviously, distant tumors and other tumors can become, progeny, and that is from the mutability effect. And what they were looking at here was trying to preserve what is called the tumoricidal bystander effect and abscopal effect. The bystander effect is you inhibit or destroy local tumor here with radiation, but we can do that with intratumoral ablation, intratumoral immunotherapy. And this then will get transferred locally to tumor cells. So inhibition, transfer locally to tumor cells to inhibit them, though they were not originally targeted, and destruction locally, but then locally transferred, though those cells that this concept of bystander effect was transferred to them then destroys them. Now, the reason why this is important is because this is going to maintain this bystander effect locally in the tumor. It's going to preserve, as they describe it, the peritumoral immune system. And this is important in harnessing, activating the immune system to then transfer that systemically. That's called the abscopal effect. It's a time and spatial concept. Local treatment, acute treatment, empowering the immune system, harnessing it, training it, and then transferring that systemically sustained to distant, untreated tumors. So it's harnessing the power locally via the bystander effect and then transferring that systemically via the abscopal effect to preserve the immune system, but it's employing the power of the immune system. Now, the way they did this study is they actually looked at 8 patients. These patients had bulky, unresectable cancer. And they followed these patients with 3 biomarkers. You've probably heard of these. First is high sensitivity C-reactive protein. This is a systemic inflammatory marker. Second is the lactate dehydrogenase. This is a marker of both tumor burden, but also of hypoxia. And then the lymphocyte monocyte ratio, which is a tumor marker looking at the differential within the white blood cells, and it really looks at immune competence. How competent is the immune system? And so they followed these 8 patients over 11.8 months, so right at 12 months, right at a year. And what they found is that based on these biomarkers, they were able to determine an average immune response fluctuation of 7.3 days. They called it immune cycle periodicity. It's the period nature of the immune cycle, the average 7.3, but it's an immune cycle fluctuation. And really what it is it's circadian rhythm. That's what it is. And they then defined these and differentiated these into 2 categories, a most favorable and least favorable. Now, the most favorable was pre-trough, meaning the lowest point of these 3 collective biomarkers, high sensitivity C-reactive protein, LDH, and lymphocyte monocyte ratio. So their lowest points collectively was the most favorable for radiation to preserve the immune system, to enhance the abscopal effect through the bystander effect. The least favorable was pre-peak, peak being the highest expression of high sensitivity C-reactive protein, LDH, and lymphocyte monocyte ratio. So what they were doing here was synchronizing the radiation with the immune system's oscillatory phases that are repetitive every 7.3 days. Again, they call it immune cycle periodicity or circadian rhythm or fluctuations. And they did this to optimize the local immune effect, to harness it, to transfer it systemically. Now, what's really exciting about this is the impact on the tumors. These patients were followed from 2017 to 2019. What they did is 2 weeks leading up to the radiation, they repeated these 3 labs every other day, again, going up to treatment. So that's the way that they measured it. 2 weeks leading up to treatment, every other day following these 3 biomarkers. And they actually targeted the definition of outcomes here based on a PET CT scan. That's a PET, positron emission tomography, plus a CT scan. And so they did this to determine really the tumor dimensions, if you will, before and after treatment. So by the way, the average immune cycle periodicity, though it was 7.3, it was 6.5 to 10 days. You can see fairly tight window there. And so what they found, this is what's super exciting. So significant bystander effect or tumoricidal bystander effect was observed in all 4 patients. So they divided 4 in the most favorable, 4 in the least favorable, and then they gave the radiation. So those in the most favorable, again, pre-trough, 4 patients during the most favorable phase, 3 had complete responses, meaning no evidence of disease. And one of the 4 had 80% regression. So if you couple those together, of the 4, 95% response rate. Again, 3 complete regression. Among the patients that were treated in the least favorable, that's pre-peak, they actually had an average tumor shrinkage of 35%. They did have one of the 4 that had a complete response, but their average across all 4 patients was 35%. So we have a 95% when coupling the radiation here to the most favorable pre-trough phase of the immune oscillation, which here being the circadian rhythm, versus 35% in those in the pre-peak, the least favorable immune oscillation or circadian phase. Quite a bit different, is it not? Now, one negative here is that there were more adverse events associated with the highly favorable or pre-trough. Now, that makes sense because in that phase, the immune system is empowered to be very active. And so what you're seeing here is simply the normal diurnal rhythm and oscillation of immune activation versus immune suppression. See, so when we think about the immune system, we think about, okay, in cancer, the immune system is either not active or it's suppressed. Understand, even in cancer, there is a fluctuation of the immune system. And so we can use that to target therapy to optimize immune activation to improve outcomes. So when looking at these 3 markers, high sensitivity C-reactive protein, lactate dehydrogenase, and lymphocyte monocyte ratio, we can, as this study showed, target radiation to maximize immune effect, locally and systemically. Now, I practice integrative oncology. That's what I practice. I love holistic natural medicine. And integrative medicine allows us to bridge the gap between disease and wellness and to bridge the gap between holistic and natural medicine and conventional medicine. And I think bridge between patient and doctor as well. But here it allows us to decrease the need for that conventional triad, what I call the unholy trinity, surgery, chemo, radiation, because they have such side effects. They're littered with such side effects. So this study focused on radiation, but what about anything that is immunotherapy, anything that's activating the immune system or working within the immune system? And it's hard to not say that almost all cancer therapies are in one way or another a form of immunotherapy. Low-dose metronomic chemo or IPT, most will look at that and go, that's a immunomodulatory therapy. See, it's not being directly cytotoxic to the cancer. It's actually promoting its senescence. It's modulating the immune system. Now that creates a challenge of its own, but here we could use that as an integrative therapy and time it to get optimal immune response, immune modulation. What about hyperthermia, which is really the repurposing of a fever? And here we could time that with the optimal activation of the immune system. Mistletoe. What about even repurposed medications that are immunomodulatory? Things such as an IL-1 antagonist, such as Kineret, or an IL-6 antagonist, such as Actimra or pirfenidone, transforming growth factor beta inhibitor. These are immunomodulatory. Even ivermectin. And ivermectin hydroxychloroquine and mebendazole. These are modulating the immune system. So might we design a protocol that peaks those plasma concentrations, what's called Cmax, at the time when the immune system is optimal? See, it really changes the way we think. It's not just the treatment of a natural, a holistic, or an integrative, or conventional. It's the timing of that treatment to optimize the impact, because it matches the most favorable phase of immune cycle oscillation, fluctuation, or circadian rhythm to activate, harness the power locally for a empowerment of the immune system to then transfer that systemically via the abscopal effect. The only way you can do that is by preserving the immune system, preserving what's called the tumor immune microenvironment instead of destroying it. That's the power of knowledge and awareness and utilization of the circadian rhythm to match the immune cycle oscillation. And I'll close with this, was from a 2024 article, British Journal of Cancer. Quote, data from 18 retrospective studies have revealed that early time of day infusion of immune checkpoint inhibiting therapies, these are things such as Keytruda, Opdivo, Yervoy, could enhance progression-free and or overall survival up to fourfold, not 1, 2, 3, but fourfold, compared to treatment of day late. Timing may be as important, if not more important, as the treatment itself. So check out the show notes, the captions below, if you will, to look and see the evidence supporting this hot take. And I'll see you on the next hot take. And don't forget the timing, because we will be bringing these to you on a regular basis. Thanks for joining us on this episode of the Prescribe Podcast. All references supporting this episode can be found on the prescribe.com website. That's pre-scribe.com. To get your next dose of medical innovation, make sure you subscribe to Prescribe. We'll see you for your next refill.